this whole concept, one of the very first things we had Hatfield talk on the very first show back in January 23rd of 2020, when we started the show, before anybody else, was herd immunity. Now, Jim Jordan's asked this question the other day, and it was about the vaccines to 90%. In your mind, as one of the top people thinking of this in the country, with kind of your logic based upon science, evidence, data, the calculation for herd immunity, isn't that a function of two things? It's a function of people that have had the virus and have antibodies, plus people that are vaccinated, and that total gets to your herd immunity, and whether your herd immunity has got to be 60%, 70%, 80%, or 90%. Is that the correct calculation?
Yes, the herd immunity is the whole population's ability to not get infected. And when we talk about herd immunity only starts when the infection curve reaches its peak, when it's at the highest. Everything after that point is more than herd immunity, and we need more than herd immunity, in fact. In order to make the infections go down quickly, you need well more than herd immunity. So herd immunity might start occurring at 50 or 60% of the population immune to the virus, but it's going to take around 75 or 80% before the curve comes down dramatically. And that's what we saw in North Dakota, South Dakota, Tennessee, Rhode Island, for example, Utah last fall in October, November, when those states were coming down dramatically. They were rapidly past herd immunity and coming down well before any vaccination started. So they had enough cases. Now, the CDC measured the number of cases in the population compared to the number that are actually registered. So the people who test positive from the nasal testing and some from the antibody testing are the numbers of cases that we know about, the official numbers of cases. But the CDC went and it measured, it did blood testing, and found that approximately 6 times that number were the total number of cases in the population. So we know now that North Dakota has had well more than 80% of the population is immune because of the herd immunity from having been exposed to the virus. Most of those people had it asymptomatically. They didn't know they had it, but they did. And that's why North Dakota has had such a dramatic response to it, because everybody is, 80% of the population is immune, which means the virus has a hard time finding new people to infect. And if you add to that vaccination, it's going to come down even more. But it was all set up from people being infected. And other states are approaching that. Half the states in the U.S. now have more than herd immunity. They're coming down dramatically. Vaccination helps, but really all this was set up last fall from the peaks of the epidemics. And what this means is that the lockdowns have been counterproductive, because the lockdowns only prolong what's going to happen as soon as those lockdowns open up. And then you have large populations that have never been exposed to the virus ready to absorb it by becoming infected. So you have Hawaii and as a prime example of that is going to have much larger epidemics until they can vaccinate a larger fraction there than anywhere else, because they have such little herd immunity, because they were functionally locked down.
Here's the thing I don't understand. Why is Fauci never talk about people that have had it as a part of the equation for herd immunity? And specifically, there was a report, I think it was in Yahoo News. It's the lead story. Oh, it must have been, I think it was an Associated Press story. It was about a month ago. And Fauci had said that in order to get to herd immunity, we're going to have to get to, I think he said at the time, 80 to 90% people vaccinated. And the only way mathematically we could do that is you were going to have to start to vaccinate school children. Now, we put that up. Nobody else covered it. It was a buried lead. We went nuts on it, and they haven't mentioned it since then. They've talked about now trying to get because at the time you hadn't even done any testing, right, of the vaccine on school children. Why, and am I missing it? Because I know you follow this from a scientific point of view. Why are they not including, or at least putting forward every day when they talk about herd immunity, part of the calculation being the population that, because it would seem to me that if you add who's been infected, coupled with, I think they say 40% of the American people have one jab, 25% have 2 jabs. If you add that, aren't we at Aren't we mathematically at herd immunity right now?
Yes, we are as an average across the country, but you have some states that had very little herd immunity to start with, and now the vaccinations have gotten them to the peak or just past the peak of the epidemic curve, and so it'll take them quite a while to come down. The vaccination, because it only cuts transmission by 50 to 60% and not by 90%, it's not that strong to shut off the infection. So yes, it is adding to herd immunity, but it's not enough to bring it down fast. And that's the reason why Dr. Fauci is still espousing distancing and mask wearing and so on, because he's trying to say we need more than just the 50 to 60% benefit in order to bring the infections down more quickly. And
okay,
so you have the states, you have the states that have too little herd immunity from before that need more vaccination, and the states that have lots of herd immunity, like I said, North Dakota, South Dakota, Tennessee, and so on, that don't need the vaccinations because they already have a large amount of herd immunity. Their case numbers are small.
Okay. I want to go back to, because Fauci's never made this case. If he would just be honest, people could then understand why he's promoting that you have to wear the mask and you have to social distance. Chuck Todd asked him that question point blank, and he never came back with the 50 to 60%, did he? So I want to hit rewind and just make your case again. When they say it's not, the efficacy is 90%, it's not really what they're talking about as far as transmissions. Just go from the top and give it to us again.
So that's right. That the vaccine companies tested the vaccines and showed in their studies originally that the vaccines reduced mild and moderate symptomatic infection by some 60 to 90%, depending on age. So for most people, let's say 90%. So people think that that means they have 90% less risk of getting infected. That's true, but that's not what matters for public health. Public health is concerned with shutting off the transmission of the virus from one person to another. And the only data that we have from that come from Israel, where they studied that in some hundreds of thousands of people who had been vaccinated, and found that vaccination by the Pfizer vaccine cut transmission 50 to 60%. So that's not bad. 50 to 60% is something. It's just that it's not good enough to do a rapid shutoff of the pandemic. It contributes to it, but it's too slow for what we really want. And so that means that Dr. Fauci is still espousing other methods to control spread in addition to vaccination. He's just not being public about that because he's feeling that, in my opinion, that people who hear that it only cuts the spread by 50 to 60% will say, well, that's not very effective. Why should I take it? Now, people should understand it's their social civic responsibility to do that, to protect others from them possibly spreading it. But still, it's not the 90% that they think they're getting. They think that something with 90% benefit means they're done. They can go out and live a normal life and do whatever they want again. And that's not what the public health people need to hear. They need to hear that the transmission is reduced by that amount, and that's not how it works.
How can businesses then it gets to what Naomi Wolf said the other day about this whole concept of vaccine passports. How do you even have the vaccine passport, which will be draconian? It's like the social credit score of the CCP. How do you do that if it's only 50%, 60% on the transmission side? How do businesses even try to implement this from a public health perspective?
So, it's irrational, and we've made everything is a gray zone and a quantitative amount into binary yes, no. And it really doesn't work for policy, and it doesn't work for science. The vaccination is one contribution. We now have an assay called T-Detect that can measure T-cell immunity, we know that T-cell immunity from SARS-1 from 2003, people still have who had SARS-1. They still have it 17 years later. So immunity to this virus is not just, we can measure the antibodies and they last 6 to 9 months and then it's gone. That isn't the whole story. The T-cell immunity is an important contribution to immunity, and that lasts much longer. And now we can measure it. And so now the question is, why aren't we doing that to see who's really immune and doesn't need vaccination? And I think that this, again, becomes, this is too complicated. We just need something yes and no, Vaccine or not, that's simple. We can do that. We can't do T-detect. We can't measure people. That's too complicated. I think we actually have to bite the bullet and do the real science.